Welcome to The Explainer. Today, we're digging into the modern approach to managing asthma. We're going to take all those clinical guidelines and turn them into a super clear path forward, so you can go from just surviving to actually thriving.
So let's just start with a really direct question, right? Is your asthma really under control? Because, a lot of people think their asthma is managed just fine, but they're actually living with all these limitations they've just kind of gotten used to. But what if you didn't have to? All right, so here's our game plan. We've got a 4-part journey today. Think of it like climbing a mountain. We'll start by defining the goal at the bottom, and by the end, we'll be mastering the whole landscape of your health.
Okay, let's get right into it. Before we can even start talking about how to manage asthma, we need to know what we're aiming for, right? We need a really clear picture of what that finish line looks like. So, what does controlled asthma actually mean? And this is where that goal gets really specific. See, well-controlled isn't just some vague idea. It's a hard benchmark. Think about the last 4 weeks. Are you having daytime symptoms more than twice a week? Are you reaching for that reliever inhaler more than twice a week? Has asthma woken you up at night, even once? If you're nodding yes to any of that, well, you're not quite at the summit of control just yet.
And to make it even simpler, there's a tool doctors use called the Asthma Control Test, the ACT, and it all boils down to this number, 19. If your score is over 19, that's the goal. That one little number tells a huge story about whether your asthma is truly under control.
Okay, so you know the goal. How do you get there? How do you get to that well-controlled state? Well, it's not a mystery. There's a really clear step-by-step approach that doctors use. It's kind of like climbing a ladder to better health.
First things first, let's just make sure we're on the same page with the lingo. You've probably heard of a SABA, a short-acting beta agonist. That's your classic blue rescue inhaler. And look, it's great for quick relief when you need it, but it's just a Band-Aid. It doesn't actually fix the underlying problem.
Now, on the other hand, you have an ICS, an inhaled corticosteroid. This is the real long-term player. This is your controller or maintenance medication. It's the one that works behind the scenes, day in and day out, to calm down that inflammation in your airways. The root cause of the whole issue. So instead of just putting out fires, this one actually prevents them from starting.
So this is how it all fits together in the modern guidelines. It's literally like climbing a ladder. The idea is to start on the lowest possible step that gets the job done. For some people, that might just be an as-needed anti-inflammatory reliever. But if that's not cutting it, you step up to maybe a daily low-dose controller. Still not there? You step up again, maybe to a medium dose. And only if you really need it, you move to that top step with add-on therapies and a specialist.
And this is a really crucial point. The goal is not to get to the top of the ladder. The goal is to find the lowest possible step that keeps you in that well-controlled zone. It's not about using more medication, it's about using the right amount of medication to live your life.
But what if you climb that ladder, you get to the top steps, and it's still not enough? For a small group of people, this is their reality. And that's when we start talking about severe asthma.
Now, severe asthma isn't just a way of saying someone's asthma is really bad. It's an actual clinical definition. It means your asthma is still uncontrolled even when you're on high-dose medications. Or it means you need those high doses just to keep things from getting out of hand.
But here's the good news. For this group, a whole new frontier of treatment has opened up. We're talking about moving beyond the standard inhalers to this revolutionary class of drugs called biologics.
And this is where it gets really cool. Think of a regular steroid like a carpet bomb. It takes out inflammation everywhere. Biologics, on the other hand, are like smart bombs. They are engineered to hunt down and take out the very specific little troublemakers. Molecules like EGE or things called interleukins that are driving your specific type of asthma. It is literally personalized medicine in action.
Okay, so we've talked a lot about medications, but getting to excellent asthma control, it isn't just about what's in your inhaler or in an injection. You have to zoom out and take a full 360-degree view of your health and your environment.
It's so important to get this. Other health issues can totally act like fuel on the asthma fire. I'm talking about things you might not even connect, like acid reflux, sleep apnea, or even chronic sinusitis. All of these can make your asthma way harder to control. So tackling them has to be part of the plan.
And in the same way, what's in the air you breathe matters. A lot. Taking the time to figure out and then avoid your personal triggers, whether it's allergens like pollen and pets, or just irritants like tobacco smoke and strong cleaning sprays, that alone can make a huge difference in how you feel and how much medicine you need.
So how do you stay on top of all this day to day? Well, there's a really powerful but super simple tool that can help. It's a little handheld device called a peak flow meter, and it's perfect for tracking your control and catching a problem before it gets serious.
And using it is dead simple. You just follow a few steps, and what you get is a hard number. It's an objective measurement of how open your airways are on any given day. And by tracking that number over time, you and your doctor can see trends, spot trouble early, and tweak your plan before you start feeling bad.
So there you have it. That's the modern map to asthma control. We've defined a destination, we've looked at the step-by-step path to get there, and we've explored the whole terrain. The goal isn't just about breathing anymore, it's about breathing freely. So now that you have the map, what's the next step on your journey? It's taking this knowledge and having a conversation with your doctor to chart your personal path to that summit.